Evening, everybody. Welcome to the Budget and Corporate Scrutiny Management Board. I'm Councillor Luke Giles and I'm going to be chairing this evening's meeting. Can I please ask all attendees to mute your microphones unless you have been invited to speak. If you wish to speak, please use the hand up icon or send a message using the chat, and you will be invited to turn on your microphone at the appropriate time. When you have finished speaking, please remember to mute your microphone. Firstly, can I call upon all board members to introduce themselves? If I can start with Laura, please.
Councillor Laura Rollins, Chair of Economy, Skills, Transport and Environment Scrutiny Board.
Thank you. Paul, please.
Paul Moore, Councillor for Hatley Heath and Chair of the Neighbourhoods and Communities Scrutiny Board.
Thank you. Elaine, please.
Councillor Elaine Giles, Chair of Health and Adult Social Care Scrutiny Board member.
Thank you. And also we have two vice chairs. One is acting up as chair. So if I can invite Liam to introduce yourself, please.
Yeah, thank you, Chair. My name is Councillor Liam Priest. I'm the Vice Chair of the Children's Services and Education Scrutiny Board.
Thank you. And Bob Piper, please.
Yeah, Councillor Bob Piper, and I'm the Vice Chair of the Adult Social Care and Health Scrutiny Panel.
Thank you for that, Bob. And any apologies for absence? I don't think there will be.
Chair.
No. I was going to say, I think everybody's here. Minutes from the previous meeting. So the meeting on the 3rd of December. I move them as a correct record. Do I have a seconder?
Seconded, Chair.
Thank you, Laura. Moving on to item number 3. Any members have any declaration of interests in the matters this evening? Any party political whips on anything?
No.
No. Okay, thank you for that. Moving to item number 4, additional items of business. There are no additional items of business this evening, and that gets us onto item number 5, the House of Lords Select Committee, Risk and Assurance Planning. Can I call upon the necessary officer who will be presenting this one? Also, we have Pete Hughes, we have invited here this evening for his comments, because I know that he's been looking at this behind the scenes. So can I have the officer first? Is that Sergit?
Yes, Chair, if you're happy if I introduce the item, but Narinda's on the call as well, and we have prepared a draft response for consideration by committee members this afternoon. I'm sure Councillor Hughes may wish to comment on some of the questions that have been posed by the House of Lords. So this is a matter that was raised by Councillor Hughes and referred to this committee for consideration. The House of Lords have invited a number of stakeholders, including local authorities, to engage in a engagement exercise that they're undertaking in relation to risk assessment and risk planning in the context of the disruptive national hazards. So the committee was appointed on the 15th of October of last year and will report by the end of November of this year. So it's given a very short period of time in order for us to respond. I think the deadline is the 28th of January for when the response is required. So unfortunately, both members as well as officers have been given a relatively short period of time to answer a series of 12 questions, which you'll see set out in the report, as well as the proposed response. And some of them are relevant, and we, as a local authority, would be able to respond to. Others are probably sitting outside the remit of local authorities. And so, but we have sought to try and address as many of those particular questions that have been posed for consideration by members this evening. So you'll see at paragraph 4.3 the various questions, that all 12 of them. I wasn't going to propose to go through each one, but really invite Narinda to outline some of the work that she's done with Chris Middleton in our resilience team in order to provide hopefully a response to the various questions and hopefully provide an opportunity for members to reflect upon that response to see whether you're content with that and if there's anything else that we should include as part of the engagement response back to the House of Lords Committee. And of course, Councillor Hughes likewise to be able to offer up any additions or indeed amends to the proposals there. So if you're happy, Chair, I'd invite Narinda to summarise some of the conversation and work that she's done with Chris in relation to pulling that proposal together.
Yeah, that's fine. We can hand over. Narinda.
Thank you, Sergio, and through you, Chair. I mean, Sergio has outlined really the purpose of the consultation and the work that we've tried to do. So, as Sergio has said, there are 12 questions there. Not all of them are necessarily applicable to local authority, but obviously those questions are there because it's a wide range of stakeholders that the House of Lords is trying to engage in this process. So I must admit, it's Chris Middleton really who's done most of the work on these and has drafted responses, because they're all to do with how well the National Risk Register reflects the risks that the UK faces really, and how they go about compiling and identifying which risks actually sit on that risk register, and how they actually filter down at more of a regional and local level as well. And because Chris Middleton is the resilience manager, he's obviously a lot more involved in the local resilience forum, where they look at the community risk register which is informed by the national risk register. And what we've done is try and compile some responses to each of those questions where we feel we can have some input into it. Now, the responses in terms of what you've got in front of you, the paper there with the questions and our narrative around it, some of it is there really for your benefit and not necessarily as a response to actually be submitted. So it's really for discussion for this scrutiny board as to what they want to actually include in that note. Like I say, some of it is really background knowledge for yourselves as well. So I don't know if you want to go through each of the questions one by one, and Chris and I will attempt to answer any questions that you've got. Chair, through you.
Yeah, what does members, how would members like to do this? Do you want to share the screen and go through individual, or do we, how would members like to take this item? If I can have some feedback, please. Okay, I don't know, just to hand back whether you want to share your screen and run through it briefly with us, and then obviously we'll come in at the end and take any questions and comments from members. Is that okay with yourself?
Yes, that's fine. Yeah. Just bear with me while I share the screen. Is that shared?
Yeah, we can see that. Yeah.
Chris, I'm happy to go through it, but you've done most of the work for this. I don't know if you want to actually talk through each of the questions, or do you want me to go through them?
No, I'm happy to give a sort of brief synopsis, as I say, to go through each question, and I certainly do invite comment from any of the councillors on. As I put out, I've tried to add in some information to kind of give you an idea of what is already going on and really apply sort of my take around some of this. The first question on there, which is about significant extreme risks. Again, the National Risk Register document, which is usually updated every 3 years at a national level, has a number of risks which it classifies as very high or high. So things like pandemics, widespread river or coastal flooding. We've certainly seen some of that in recent years. A few others in there, including widespread electricity failures, where it could be crossing large regions of the country. And then we've got the sort of CBRN or sort of nuclear incidents. So if that was at an industrial nuclear site, or if there was some sort of nuclear threat to the country. Just looking at those sort of extreme risks, and we'll get a bit onto it. There is a bit on there where we talk about a reasonable worst case scenario. So for each risk that they look at the national level, they understand what is a plausible sort of scenario which could carry out, and that is what we sort of plan around at the national level, but also at the local level as well. So we could also consider extreme risks to be those which go beyond that sort of reasonable worst case scenario. One of which we can consider COVID-19 at the moment. So there was a planning scenario in the National Risk Register in 2017 for a flu pandemic, which is how we work. What it was used as a sort of planning assumption to plan around. But really, COVID, as we've seen, and the sort of measures that have been put in place, goes beyond that sort of what was that reasonable worst case scenario that we were using. There's a second part of that about linked risks and whether risks are sort of individual, but really when we are starting to look at this sort of more extreme events and extreme risks, they are very much linked. And again, as we've seen with the pandemic, it's not just the health impact, but the impact on our social structures, on commercial systems as well. And that's very similar when we look at other sort of extreme risks as well. If we want to move on to question 2, essentially looking at this, I don't feel that the UK is that poorly prepared for any risks, or if we are poorly prepared, it is done really with a view that it is on a cost-benefit analysis. So you can prepare for sort of all risks if you throw enough money at it. It is quite a simple way of putting it, but it's not really make economical sense to do that. One thing I have highlighted in here is probably our vulnerable to extreme hot and cold events, which we might see an increase in both severity and likelihood due to climate change. So as a council, and I know councils across the country have declared climate emergencies. This is something that we are looking at. We have something we are working around. However, there is a risk that essentially if the speed of change is greater than our capacity to adapt, whether that's as an organisation, but particularly with the public and the commercial sector, then we could end up being in a poorly prepared situation. We'll move down to number 3. Again, so this is just an overview of how essentially risk assessment is passed down from the national level and comes down to the local level. So the national risk assessment is done every 3 years by the Civil Contingency Secretariat, and that feeds through to the local level. The Civil Contingencies Act, which we all work under as a local authority, we're category 1 responder, along with other blue light agencies, so police, fire, ambulance, and the hospitals. We get together in a forum which we call the Local Resilience Forum, which I'm sure you might have heard a bit about over the last year. And within that forum, there's a group collection, which we call a risk assessment working group. And that's where we maintain a community risk register. And there is a version available on a West Midlands Prepared website, where we look at the risks locally that we face across the West Midlands conurbation, and we produce a public-facing version as well. So members of the public have an idea of the risks in the local area as well. Question 4, as I've outlined, is about seeking assurance. So sort of assurance which is already in place, but have pinned around a principle called subsidiarity. which is used in integrated emergency management, where decisions should be taken at the lowest appropriate level. So it allows people who are essentially operational people to make decisions, but where they can't make a decision at that level, it is escalated up. And the same can be applied really around assurance. So as an agency, the council, we have a risk assessment process in place, and we have a risk register in place, and that some of those risks are around emergency planning and around business continuity. And as an agency, we make sure we provide reassurance to ourselves that we are managing those risks. And then that reassurance then feeds up into sort of the LRF, where the LRF is seeking assurance from ourselves that yes, this agency can support its risks, and then that should feed up through government departments, so ourselves through MHCLG and the Resilience and Emergencies Division, so they can seek reassurance from the LRF that this LRF is prepared and they are managing those risks. Question 5, so just a bit of outline. So again, whether it doesn't necessarily need a focus on identifying all the risks and things that are going on, because we work emergency planning is addressing the impacts of those risks, and many of the impacts are felt depending on what the risk is might be in the same way. So the example I've just tried to outline there is we could see something impacting on service delivery, we could see members of the public displaced and a large number of injured persons. However, the risk itself could be a large fire, could be a big transport accident, could be an attack, could be flooding. So each of those risks, there are certain things that we need to do, which we call capabilities. I suppose what we're looking at around here is making sure that we have the right capabilities in place, but that we also have them at the right capacity. Capabilities putting in place is quite easy. If we identify them, we can do something about them. Capacity partly comes down to how much we're willing to put in place. Simple thing is, how many fire engines do we need? Do we have sufficient capacity for that? And what will work is that we'll reduce the capacity down as we will see it. So we have a surge capacity that we can use in an incident, but really to keep sort of business as usual going. As you've seen with hospitals through the COVID-19, we had capacity to manage a number of people, particularly around ventilators, and they've looked at surging that capacity to put that in place to respond to the incident. So we don't need all of that usually as a sort of business as usual case, but we haven't put that in place due to an incident. If we look down to 6, again, if you've done any risk assessment work, either with the council or outside, risk matrices are often used where you put in 2 likelihoods and come up with a scoring system. I know we use them in the council, we certainly use them at a local risk management level, and they are good for identifying priorities, which are the highest risks, what do we need to be working on, and also if a risk remains very high, to ensure that it's escalated up as well. If we move past question 7, that is for government departments. Question 8 is about how national plans are communicated. So there are a variety of ways of essentially informing local emergency planners about changes to national plans. We do have a digital repository system, which is used by agencies across the country, and often government departments will put their plan on there, send out a alert, an email, which will go to everyone who's signed in or logged using the system, so they're not signed in, to make them aware that there has been an update to a plan in that way. But we do have quarterly meetings as an ARF, and we have MHCLG advisors will come in and they'll share information on plans if they're aware of it, and also the agencies that are responsible for updating national plans. Often, so I know we've had people such as BT in, and certainly Network Rail, and I'm trying to think of another one who's just changed their name, who will come in, join in one of our meetings, and they'll give a presentation on their plan, any changes to it, and then we can take that on board and we can filter that into our local plans and see if there are any changes need to be made. One other thing there, we're looking at the capability of local responders to plan and increasing that. So that's something which has been going on for a number of years now. So teams often in local authorities have shrunk, and not just in local authorities but in all agencies. So we've always looked at how we can do more with less. One of those ways is increasing technology, and certainly the last year has seen that massive increase now in technology, and now we're having meetings virtually, which is increasing the amount we can do. But one thing we've seen in the Black Country and in other areas is where we have a need for an emergency plan. Instead of each agency writing their own plan, which is what would usually have happened in the past, one authority will take on writing a more generic plan for that, and then each of the other authorities can contribute into that but add their own agency specific information into it. If we look at number 9. So number 9 again is in relating to individuals and communities. Now this is my sort of opinion or my take on it. If we were looking to increase the ability of individuals or communities to make them more resilient, what I've seen working not just in Sandwell but in other local authorities is that often the preparedness of individuals will be related to either they have regular experience of risk events. So if you work in rural areas which are often flooded, then those people know, they often get flooded, they know how to respond and know how to look after themselves. But also those who have the sort of social economical means to support themselves. So individuals who have emergency savings that they can call upon, and if they have insurance. And in urban areas where they don't necessarily have those in place, that means that they call more on the support of local agencies. When we're looking at building individual resilience or community resilience, we need to increasing their resilience allows them to absorb and rebound the shock from a national crisis. And to do that, we need to make them more resilient, whether that is economically, social economically, but also through their physical and mental health. So when an event does occur, they can take that shock, they can manage it themselves without having to fall on to local agencies for that support. But we still will provide a sort of catch-all for the most vulnerable. But if we do see an increase in sort of large risk events, and we're going to see more people involved in them, then I think that's probably the strongest or most efficient way anyway of supporting them. And again, question 10 around developing resilience capacity through risk. Oh, so around exercising this one. So we do exercise, we do testing as a agency and as a forum with different agencies, multi-agency work. That should be, or we do hope that is driven by risk planning. So through the risk work, we will identify risks that need to be planned, need to be exercised, but identify those capacities or capabilities. So we identify capabilities that we need to be testing, and they will be built into an exercise program so we can make sure that we have exercised them in a good amount of time. How much exercising we do, I mean, within a local authority setting, we do training with frontline staff, with senior management, but again, there is a limit in that versus the day-to-day activity. So how much we can spend training and doing things for events that may or may not occur, when actually, in fact, the best use of their time is engaging with communities and improving them. Number 11 I've left because that's really from a corporate risk management process. We're not involved, and I haven't included question 12 as well because I very much feel this is a policy decision, which yourselves might have some more input on around that, and things that the government could put in place, either policies or processes, to sort of strengthen certainly the UK population against extreme risks. Thank you.
Thanks for that. Has any members got any comments or questions at this present time? And then, no, Pete Hughes, have you got anything you want to add on this subject?
Yes, Chair. I appreciate the report that's just been presented, but I felt that it was more a case of what is rather than an analytical sort of approach to what is missing, if you know what I'm saying. You know, the purpose of this select committee is to find out what's wrong with the with the procedures and with the setup that it is in place at the moment, and to try and improve it, particularly where there's a local interest involved. You know, I think what this pandemic, for instance, proved was a little lack of preparedness of local government. I'm not just saying Sandwell, but all local authorities in relation to having the third sector and the community stepping up to assist. It almost happened by accident in some instances. I will be critical in relation to Sandwell. It was under different leadership at that time, but I thought there was a complete disconnect between the centre and perhaps what was happening at the town level, and that's just my observation, and a complete lack of information giving to local authority members over the first few months. I mean, I was particularly aware that we're dealing for something for the first time of such significance, but not having members aware of what was going on at the front end was, I think, really disconcerting. And I think this is where items 8 and item 9 really, Chris, I have to say, need some digging into terms of what the weaknesses were. We need to own up as to what weaknesses or gaps there were, and that's not only for ourselves, but in relation to the way the government responded to us. And I really don't think what you've delivered to us, and you know, it sounds critical, but I don't think what you've delivered to us has been an analytical look at what the problems have been, particularly with the thing that we're actually dealing with at the moment, which is a COVID-19 pandemic. I think the other concern I've got, you've mentioned the community risk register, and I've got 2 laptops going at the moment. I've got my council laptop and my own, and I thought what I'd do is go on to the Sandwell website and look for community risk register on it. And what I've got come up is a PDF of a community risk register, which is dated 2014. We're in 2021, 7 years later. Now I don't know whether that's the way the website is set up, but that's what it got me to. I think I went into one in Coventry, and that was giving me something completely different. You're saying that the councils are working together, and I'm a bit concerned again that even the documentation that we've got, which is public facing, is not up to date, or how can you say it's not fit for purpose, is it? It's just a few observations that I've got, but first and foremost, the purpose of my bringing this to the leader and chief executive's attention, which I think, and the suggestion that it was looked at by Scrutiny, was to actually scrutinise what was wrong. We shouldn't look at what is, we should look at gaps, and I certainly don't think that what we've been delivered is looking at the gaps or feeding into the select committee ideas for how they could improve things going forward. Stating what is of no use whatsoever. Sorry.
No, thanks for them comments, Pete. I know Councillor Liam Priest has got his hand up, and then obviously we'll note that, and we'll see. I'll bring Liam in at this moment. Liam.
Yeah, thanks. Thanks, Chair. Yeah, just to build on what Councillor Hughes said, I think I accept all of Councillor Hughes's points, and I think he makes some good points there. I think in terms of Councillor Hughes's central point around the council's response to the coronavirus epidemic within Sandwell, I think it would be nearly impossible to have a proper look at that event, seeing as it's still happening in one meeting. I mean, what we could do, Chair, is I suppose at some point in the future, when the virus has hopefully subsided, we can then have a learning exercise across the council to understand how we responded and how our services handled the stress that was brought by the pandemic. But that would be some time away, I should imagine, towards the later part of this year. But I would expect the council to undertake some sort of learning exercise and evaluation process, which would ultimately feed into the national inquiry that is going to take place apparently at some point as well. But I'd expect, Chair, that scrutiny plays its part in that at that point. I don't think we can probably really truly assess what's happened with the COVID-19 epidemic within Sandwell until it's finished. Thank you, Chair.
Yeah, thanks for that comment, Liam. Yeah, I probably agree with that. How can we pull apart and scrutinise the response when we're still responding? So if I can just see if anybody else wants to come in at this moment in time. What I would like to do, if we'll probably note this and obviously take Pete Hughes' comments on board, and perhaps when we come to hopefully the end of this pandemic, we can maybe have a scrutiny session where we can, pull apart and digest the response in a bit more detail, and invite Councillor Pete Hughes along for that if Pete would like to join us. But if members are okay, if we can note Pete's response on that. Sergi, have you got anything to add to that before we move on?
Chair, just I guess in terms of your resolution, one option obviously is to we can take the comments on board, take them away. We can have a look again in terms of how we can focus on the issues, looking in terms of gaps, as Councillor Hughes has indicated. And if the committee is minded, could agree that you agree the final response, given that a response is due by the 28th of January, so time is limited. But hopefully in the intervening period, we're able to pick up as many of the points and elaborate a little bit further on the response, having regard to the views that have been expressed. And Chris, myself and Narinda can look at how we can enhance that response with you, if the committee agrees, signing that off so that we can submit it on the 28th, or alternatively, if the committee is minded not to respond, then resolving that tonight. So at least we are clear in terms of, is the council responding to the consultation that has been requested.
Well, Bob Piper's got his hand up, so if I can just bring Bob in for the moment.
Yeah, I think Sergio's point about getting a response in by the 28th, but I think the point that Pete Hughes was making was more about whether the council's resilience was good enough actually to deal with both foreseen risks and unforeseen risks, really, and whether we've actually got a proper response to risks that may or may. I mean, if somebody had done a risk register, say 2-3 years ago, nobody would have had a pandemic on the risk register and what we've got to do to respond to it, really. So it's about trying to ensure that you've built a resilience into the local authority to deal with risks as they arise, and those are the points I thought I'd picked up from what Pete was saying. And I think those things need to go ahead irrespective of what happens on the 28th, or even whether we put a response in at all, really. We need to look as a local authority to ensure we've got that resilience.
Thanks for that, Bob. Narinda?
Thank you, Chair. Just to pick up on the points that Councillor Piper, Councillor Priest, Sergeant and Councillor Hughes have mentioned. Chris mentioned that we do test exercises, and after every test exercise we do a lessons learned. So the point that Councillor Priest made about doing a lessons learned exercise, that will inevitably take place. I mean, obviously we're doing sort of lessons learned as we're going through the pandemic as well, and trying to build in anything that we've learnt to date into how we deal with the pandemic going forward as well. But there will be a lessons learnt programme, exercise, sorry, done at some point in the future, once, you know, we've seen our way through most of the pandemic. And then the other matter is, you know, those test exercises that we do. So there are various exercises that we do test. For example, you know, a cybersecurity attack. We've tested we've got various emergency plans in place, which I know Chris hasn't had the opportunity to actually say as part of the response in these questions. So we'll have like a rest centre plan, a mortuary plan, and various other emergency plans, and each of those are tested on a risk basis with frontline officers, with senior management, some with multi-agency partners as well. So we do those test exercises, but I suppose doing it, and it's about trying to make that test exercise as real as possible, and it's always going to be difficult to make it real because it is a test exercise. Councillor Piper mentioned about like the flu pandemic. So I think years ago when we had like was it H1N1 bird flu, you know, we did do a lot of work around planning for bird flu, as it was called then, and you know, put arrangements in place then. But obviously, I don't think anybody foresaw the severity of the pandemic that we're currently in, and it is really about just revisiting those risk assessments. But again, that risk assessment will be informed by nationally what they think at a national level, what we think at a regional level, and then how that translates into a local level. So the information just doesn't flow sort of from the national to the local level, it does go back up from local to national level as well. So whilst we do have all these procedures in place, I suppose it is looking at the robustness and how often we can do these test exercises. Again, as Chris mentioned, you know, what we're testing here is things that may or may not happen, and it's about the resource that is required in actually planning for these events and even planning for these test exercises as well. But we will definitely be doing the lessons learned exercise at some point in the future.
Right, thanks for that. Councillor Hughes has got his hand up. I can bring him in, and then obviously we'll try and wrap this one up and move it forward. Peter? Pete, are you there?
Yeah. I just think that we also need to look at what, you know, I mean, there's never been a more perfect example of what this is all about than what we're going through at the moment. And I've heard sufficient both from council briefings and from on the news to know that there have been deficiencies in the way central government have worked with local authorities on various things, and that's what I'm trying to point to, and what this, I think, is asking to be brought out. What, you know, what deficiencies have been shown up from government work and communication with local authorities in times like these. You know, it's asking, are the potential benefits in increasing public involvement in emergency planning? As I say, are we answering that? Do we need to get the public, the third sector, the voluntary groups more involved in case scenarios where that might take place, whether it's flooding, power surges, and power going down in major parts of the borough. Do you know what I mean? Have we got that all in place? Do we need to talk more outside of what we do already, or do we do it as an internal exercise? To be honest with you, as a normal ward member, I wouldn't know. I just wouldn't know. But it's asking you there. The government are asking us through the House of Lords. Do we need to get more local people, local responders, more involved in planning for the future, whether it be a pandemic or anything else? So I think what I'm trying to dig at, basically, Chair, is that there are questions being asked there that I don't think we've necessarily answering with the information that's been presented to us tonight. And I think Sergit has indicated that it does need to be relooked at. And I think if Lisa were here presenting information tonight, she would instantly be saying, well, this was a weakness with the government. I know this is a weakness that we weren't prepared for. I'm sure there would be things coming out of conversations, and I know she's heavily involved in what's going on now, but surely there's got to have been some weaknesses that have been thrown up. The leader in charge at the moment must know of things that have gone wrong that we don't know about. That's what I'm trying to get at. We've got to the 28th. I only became aware of this when it popped up on something. I keep involved with the government web page that comes out to me, and I only found out about this just over a week ago. So I've got it to you as soon as you can. And I know it's the 28th, but I do feel that we should be responding with something. Thank you.
Thanks for that. David Stevens, indicating you want to come in.
Yeah, thanks, Chair. Just to help the committee, I'm happy to support the idea of reviewing those elements, as Councillor Hughes has said. There have been quite a number of areas where I think we could have seen improvements. We, as officers, just need to be careful in that process that we're not overtly seen to be behaving politically and making any criticisms of the government. So absolutely, we can take that on board, take it away, and do some work on that really, really quickly, if that's helpful.
Yeah, if members are okay with us agreeing with that, and obviously me and Sergi and the others will work behind the scenes to tweak that to make the amendments that Peter Hughes has identified. And members are okay with that?
I'm happy with that too.
Chair, yeah.
Yeah.
I'm happy
Elaine?
with that as well.
Okay, thanks for that. And if obviously we can hand that over to Sergi to we'll do a bit more work on that and get that sent over. And thank you, Pete Hughes, for joining us this evening, and thank you for bringing this to today's meeting. We're going to move on now to item number 6, which is the COVID-19 impact of the Leisure Trust. If I could ask the officer, which will be David Stevens, I believe, to give us an update, please.
Sorry, Chair, I'm not sure that's Sergi.
Is that Sergi? Is that you? Sorry, I do apologise. Is he with us?
Yeah, thank you, Chair. Yeah, so this is the follow-up really on your previous discussion in relation to Sandwell Leisure Trust and the external consultant's findings and the suspicions that you had in relation to this matter. And you had the opportunity to obviously discuss matters with SLT previously. And it's really an opportunity now for you to consider the recommendations that you'd like to put forward in connection with this matter. There may be discussions that we need to have in relation to this matter that require us to go into exempt session. And I'd be grateful, Chair, if you would want to discuss that with the committee so that we could have a discussion in exempt session.
Yeah, I was going to put that, if I can put forward a motion that that the public and press are exempt from the rest of the meeting. This is to avoid the possible disclosure of exempt information under Schedule 12A of the Local Government Act 1972, as amended by the Local Government Access to Information Variation 2016, relating to the financial, business and affairs of any particular person, including any information that the authority holds. If I can put that motion forward that we move to a private session, can I have a seconder, please?
I'll second that, Chair, yeah.
Yeah, thank you, Councillor Moore. And can we take a vote on that as well? Councillor Moore?
For.
Elaine Giles?
For.
Laura Rollins?
For.
Thank you for that. If we can move to private session now, please. And for everybody who's obviously